Once a respirologist is able to diagnose and let you know if you have sleep apnea, there's really two essential ways to treat sleep apnea. One is with a CPAP machine. That's kind of been the gold standard over the many years of how to treat sleep apnea. It's with they usually have some sort of a mask or nasal cannulas that go to your nose, and what it does is it just puts oxygen into your airway, and it kind of forces the oxygen. You're hooked up to a machine that pumps the air into your airway, keeping it open so that you can get the oxygen that you need. It's a very good way, and it's a sure way. The only trouble with it is sometimes people can't tolerate it. The compliance rates with CPAP machines are not the highest. They're about 50%, and in some cases less. But for those patients that need it and it works for them, it's an excellent choice and is going to work every time. The other way to treat sleep apnea is through an oral appliance. And what people like about the oral appliance is it's a little less invasive. Once they get used to having something in their mouth, they're able to sleep any which way they like. They can sleep on their side, on their back. They don't need electricity if they're camping. So there's lots of advantages in that way. Often people are already used to wearing, if they've had braces, after they've had braces they have retainers. Some people are already wearing like a bruxism or a grinding splint at night just to help their teeth to not wear down. And so it's not too far-fetched for most people to be able to use an appliance in their mouth. And in some cases, for people that have snoring and sleep apnea and also have bruxism or grinding, it's perfect because it allows you to treat both conditions at the same time. So once we've kind of find out, if the respirologist comes back with the sleep test saying that the candidate or the patient is able to use either or, the CPAP machine or the oral appliance, then that patient at that point can choose. And I'm totally comfortable with them choosing a CPAP machine if they want to try that. Like I said, if it works for the patient, it works really well for them, and that's important. But for a lot of patients, they don't necessarily love the CPAP machine, and so we find the compliance rates significantly higher with an oral appliance, up in the range of 90%. People wear it and like it and find that it helps them, and so if people can wear that, they tend to like that a lot better.